Hi, my name is Ankit Patel. I'm a surgical oncologist at Roswell Park Comprehensive Cancer Center. I specialize in HIPEC, which stands for heated intraperitoneal chemotherapy, is a treatment modality we use to treat peritoneal surface malignancies. Now, these cancers can arise primarily from the peritoneal cavity, or they can spread from another organ to the peritoneal cavity. We would call this peritoneal carcinomatosis. These patients, before the advent of HIPEC, really didn't have a lot of treatment options and, didn't live very long. And so HIPEC was an endeavor that was born from an effort to help these patients, and it's found to be very effective for the right patient and the right cancer. Traditionally, HIPEC is part of a two-part procedure. The first part really is cytoreductive surgery. This is a debulking surgery to remove as much cancer as possible from a patient's abdominal cavity. In that sense, we remove all the macroscopic disease, and then HIPEC, that intraperitoneal chemotherapy, is meant to treat any of that microscopic disease that might be left behind or that we couldn't get to. The combination of the two is really what makes this treatment modality work, the surgery plus the intraperitoneal chemotherapy. Patient selection for candidates for CRS and HIPEC, or cytoreductive surgery and HIPEC, is quite complex. I think generally speaking, we do accept that HIPEC is the standard of care for certain histologies, including peritoneal mesothelioma and appendiceal cancer. We are very selective about patients with metastatic colorectal cancer. And for patients with metastatic gastric cancer or other GI cancers, we tend to be extremely selective in the sense of considering clinical trial use or other avenues for that. So those are the general types of cancers we use. But more importantly, it does come down to some broad categories of histology, grade of tumor, the patient's functional status, as well as their goals of care. Patients that might be an appropriate candidate for cytoreductive surgery and HIPEC include patients with appendiceal cancer, metastatic colorectal cancer, metastatic ovarian cancer, and even some upper GI cancers such as gastric cancer. And then it is the standard of care treatment for peritoneal mesothelioma as well. Well, we know that for a lot of cancers that are spread in the abdomen, systemic chemotherapy doesn't have adequate penetration. And so HIPEC offers a direct interaction between cancer cells and chemotherapy. And we also know that the heat kind of augments that chemotherapy effect. So based on this, HIPEC is a very useful way of treating cancer that is very much isolated but spread throughout the abdominal cavity. Because HIPEC is a complex procedure, we really encourage patients to go to a place that does this at a high volume. Here at Roswell, we've been performing this operation for over 20 years, and we're considered a regional expert, not only locally, but in all of Western and upstate New York. We've taken this to a place where we're advancing the technology and the techniques of HIPEC, such as minimally invasive avenues, as well as aerosolized versions of it. We have slowly started considering clinical trial access for our HIPEC patients, so we offer a lot of different resources that are adjacent to intraperitoneal chemotherapy as well. One of the more important things to consider is that patients who are considered a candidate for HIPEC are often on a very long treatment journey. The surgery and the HIPEC is usually not the only thing that they're going to encounter. More often than not, their treatment involves systemic chemotherapy and radiation or some other modality. So here at Roswell, we really take that into account. We're approaching these patients in a very multidisciplinary fashion, and so we can guide them through their entire treatment journey, not just the surgery and HIPEC aspect of it. That's what we consider extremely important, and that's what we want to offer your patients. If you have a patient that you think would be a potential candidate, please feel free to call us here, and we'd be happy to answer any questions.